السلام عليكم ورحمة الله وبركاته. هنتكلم النهاردة إن شاء الله عن كيفية تجهيز المستشفى لاعتماد سباهي من خلال تجهيز ملف الانفكشن كنترول بالمستشفى. Today إن شاء الله we'll talk about how to prepare your hospital for CBAHI accreditation through preparation of infection control file. First of all, I'd like to thank Dr. Hagar Zogbi for participation in this presentation. She prepared almost of this presentation. Thank you so much. In our presentation, we will talk briefly about the CBAHI standard and the substandard, scoring methodology by surveyor for each standard, what is the meaning of CBAHI ESR standard, personal file required by the surveyor, and the standard implemented by the documentation. Also, we'll talk about the standard which implemented by observation, and how to prepare your staff for CBAHI surveyor interview, and what are the most questions asked by CBAHI surveyor. This is our topics today. So, the goal of this presentation to prepare your department as infection control for CBAHI accreditation. Infection control standard in CBAHI accreditation, the total standard are 44 standards. Each standard include some of substandard. So the total substandard for infection control file are 188 substandard. Two of these 44 standard are ESR. What is the meaning of ESR? ESR means essential safety requirement. That means this standard is very, very important. And there is no accreditation without implementing these two standards. This is the scoring methodology for the surveyor. Each substandard will be evaluated by the surveyor and will take a score starting from 0 to 2. 0 not met, 1 partially met, 2 fully met. And if this standard not implemented inside the hospital or this service not included in the hospital service, it will be not applicable. This is the scoring methodology. As we see here, each substandard checked by the surveyor through observation or interview, BF personal file, and D is the documentation. This is the scoring methodology done by the surveyor. We have two ESR standard as we mentioned before. Standard number 4, which talk about the infection control committee, and standard number 15, which talk about the isolation precautions inside the hospital. If we talk about the committee should be implemented as the standard quarterly, each 3 months, or monthly as per the hospital policy, mother policy. How to implement the infection control standard number 4 for the committee? It's very important for the surveyor to check main 4 papers or 4 documents for the committee. First one is the agenda for each committee, which includes a member for the committee, which should involve representative from each department in the hospital. This is the agenda. Second document is the committee minutes, which includes the discussion done inside the committee and the recommendation and the time frame for each point. Third one is the attendance sheet for the member who attends the committee. And last document will be evidence that all these members received the minutes of the committee. So each committee should include these 4 documents: agenda, committee minutes, attendance sheet, and evidence for receiving the minutes by email, by signature, by any type. So this is for the committee. And of course, the surveyor will check the sequence of the points. So for example, if we have committee in January and there are some points are still open, he will check it in the next committee in April. He will check these points closed or not. Even it will be extended to the end of the year. So the following up of the minutes is very, very, very important. This is for the standard number 4, the committee. For the standard number 15, which is the second ESR standard, talk about the isolation. He will check the isolation room ratio to the bed capacity of the hospital. As the standard mentioned, we should have one isolation room for each 25 or 30 bed for the normal ward. For the ICU and the critical area, one isolation room for each 8 bed. This is the ratio. He will check the parameter for each isolation room, like temperature, humidity, air cycling, and of course the negative pressure for the airborne isolation room. He will ask about the isolation signs and the precaution taken for the patient inside the room and during the transportation of the patient from department to another department or from the hospital to another hospital. This is the questions and evidence of isolation precautions inside the hospital. This is a 2 standard. The importance of the ESR standard, that this standard should be fully met, not accepted partially met. The surveyor will evaluate these 2 standards, met or not met. So each substandard from this 2 standard is very, very important. And you have to provide evidence that every substandard is implemented inside the hospital. So we'll talk about general for all standard of the infection control file. The surveyor will check these 4 points for each substandard: the document, observation, staff interview, and personal file. So each substandard should be there is evidence for its implementation by one of them or more than 1 point of these 4 points. For the document, we will talk about the policy procedures, forms, posters, contract. We will check all of them. Observation will done through the surveyor round for each department. Staff interview, we'll talk about the most questions asked by the surveyor. And we will talk finally about the personal file and what is the paper required to be inside the personal file. First, documentation part of the survey for the policy. What the surveyor will check about the policy? He will check that all policy and the procedure are available in each department. All staff can access to these policy procedures, and all staff know how to extract his own policy from the infection control manual. So all the staff should be trained about the path of the manual. If it was soft copy or if it was hard copy, should be available in the department. The forms. What is the aim of the forms and why the surveyor will check the forms? As we said before, anything not documented, it means it's not done. So he will check forms to inform or ensure that your practice is implemented properly. So this is a list of some forms which should be available for the surveyor. First, daily cleaning schedule for each department, which indicates that this area is cleaned periodically by the housekeeping. All staff should have valid respiratory card, which is fit test or pixel card. Terminal cleaning for the room after the infectious patient or after discharge of the patient. Curtain log sheet. As a guideline, the curtain should be changed monthly. So each department should have log sheet or logbook. Ensure that this curtain changed monthly or according to the hospital policy. For the staff enter the isolation room, we should provide log sheet for them and for the visitor also. For the isolation room, as we mentioned before, we have to document the 4 parameters for each negative pressure room, which is negative pressure, temperature, humidity, and air cycle. Notification form to the infection control department for any infectious or communicable disease. Temperature log sheet for the store and the refrigerators and the medication rooms. Daily monitoring for the medical stock and the bar level. Daily equipment cleaning, especially in the critical area. Operation room monitoring sheet and anesthesia machine cleaning log sheet also. The bundle form inside the patient file is very, very important for any patient has any device should provide bundle form for him and implement it, and he will ask the staff about this, the component for each bundle, and we will talk about it in next slides. And the final patient and family education. This form is very important also. And finally, he will check the KPIs for infection control. Should be distributed and posted for each department. This KPIs should be include at least hand hygiene rate for each department and for all the hospital, surveillance rate for healthcare acquired infection, and needle-stick injury rates. If you have any more KPIs for your hospital, should be distributed and posted also. This is the form. These are the forms which a supplier should check it in each department. He may go to ICU, check some of them. He will go to the ward and check others, like that. Point number 3 for the documentation, which is the posters. This posters is very important and indicates that there is orientation program for the staff and the visitors. The most important poster should be available and posted everywhere in the hospital, like hand hygiene, which include hand wash and hand rub, 5 moments, PPE during and doffing, especially in the isolation area, blood spill management, and it's better to also be provided inside the blood spill kit. It's very important. Cough etiquette, visitor education posters, the isolation signs. We have 3 types of isolation: contact, droplet, airborne. For each type of them, we have isolation signs, which is posted on the door, and another one for transportation of the patient. Also, he will check the poster for patient pathway from ER to inside the hospital, whichever to the ward or to the ICU. These are the posters. Point number 4 for the documentation is a contract. The surveyor will check the contract for medical waste management, which mainly with SIPCO or another hospital for any country. Best control contract, outsourced contract. If your hospital dealing with another hospital for CSAD, for example, for laundry, you should provide this contract for the surveyor. Supplies and equipment order and purchasing. Infection control should be, must be involved in any purchasing process related to the infection control, like disinfectant, antiseptic, CSSD disinfectant. He will check all of them. So now we finish the first point, which is the documentation part of the survey. If you work on these points and ensure that all these points are available, this part will be complete for you. Second issue is the observation. Some standard implemented by the observation and evaluated by the surveyor by the observation during his round. Like what? He will observe, of course, the hand hygiene. Hand hygiene dispenser available for the hospital and in enough amount or not. The steps of hand hygiene done by the staff during the 5 moments. So during his route for any area in the hospital, he will check. For example, if the nurse get out from the patient room, did hand hygiene or not. The steps and the sequence of PPE donning and doffing, he may observe it or ask the staff about it. Waste segregation, you of course will check it. Waste container availability and overfilled. Sharp container should be hanging on the wall, not on the floor. He will observe any recapping inside the sharp container. He will observe how to manage blood spill, and he will ask the staff about how to do it and the availability of the blood spill kit in everywhere inside the hospital. He will check the anti-room for the negative pressure isolation room and the availability of the PPE inside it. And he will ask the staff where you donning the PPE and where you doffing it. He will check the multi-dose medication and the expiration date for each one and the opening date record on it or not. He will check the expiration date for any supplies in the area. He will check the stock room and the shelves. He will check the cleaning for all any storage room. He will check the boxes, that there is no boxes of cartons inside the medical stock, and any room not occupied with patient, the waste container have to be changed and free from any waste. Of course, after the discharge of any patient, the room should be very clean from any patient supplies before. If you have bubble, he will ask about it and how to disinfect it between the staff. He will check the CSD and will ask the staff how to transfer your instrument to the CSD. I will check the clean and the dirty utility room and the temperature documentation for each room. Dry sweeping is not allowed inside the hospital, so any supplies used for dry sweeping should be not available inside the hospital. We will check the disinfectant and the involvement of the infection control in the purchasing for this disinfectant. He will ask about or observe the medical waste segregation. We can, everyone inside his hospital can make a scheme like that. It's one example only, and mention the color of the bags and how to discard each type of the waste inside the hospital and make this like this and distribute it everywhere in the hospital for staff orientation. It will help the staff to be commitment for the medical waste segregation. I will check the patient file to check the bundle implementation for any patient has device, and he will observe the patient and family education form inside the patient file. Okay, now we will talk about what is the most question asked by the surveyor during the staff interview. The next points, all infection control team should train the staff how to answer and what is the questions will be asked. So he may ask the staff, what is the aim of infection control team inside the hospital? So the staff should be trained that our goal inside the hospital to prevent infection transmission between patient, staff, and the visitors, and controlling any spread of infection inside the hospital. Also, the surveyor will ask about the standard precaution and what is the meaning of standard precaution. Our answer, standard precaution, which these are the precautions which are implemented for any patient, regardless of their diagnosis. And according to GCC and CDC, these are 8 points called standard precaution or universal precautions, which include hand hygiene, PPE, handling and disposal of contaminated items, lab specimen management, room cleaning, patient placement, cough etiquette, food and drink at the workstation. These are 8 points called standard precautions. We will talk briefly about each one. For the hand hygiene, the most important question asked by the surveyor, what are the types of hand hygiene? We have 3 types: surgical scrub, which is related to operation room, hand wash and hand rub for other area. The duration is very, very important, and there is no survey without asking about the duration for each type. So all staff should be trained about them. The 5 moments, he will observe and ask the staff about them. And the sequence for hand rub and hand wash. We will ask the staff show me how to make hand wash or show me how to make hand rub. So all the staff should be trained and practice hand hygiene every time. And this is for hand scrub. Okay, he may ask the staff, if your hands are visibly soiled, you can do hand rub or not. We have to learn our staff that when your hands are visibly soiled, only you can do hand wash, not allowed to you to make hand rub. And this question asked to me last week during my survey, by the way. So the surveyor asked the staff, ICU staff, when you have to do hand wash and don't do hand rub. The perfect answer will be I have to do hand wash only when my hands are visible soil and when I care for patient infected with Clostridium difficile. For patient infected with Clostridium, we can't do hand rub. We have to do hand wash, and it's also a common question in civic exam. So the surveyor may ask the staff, what is the meaning of PPE, which is personal protective equipment, which is gown, mask, gloves, and face shield. And we have two types of the mask, surgical mask and the mask N95, which should be used only when the staff did fit test. And everyone from our staff should have card for fit test or the pixel card at least, which include his size for the mask N95. And he also, the surveyor will check the card and will check the availability of this mask in the area for the staff. For example, if the surveyor went to ICU, he will check the fit test for one staff. For example, it's large. So he will ask the staff, show me the large mask available for you. So it's very, very important to distribute all the masks everywhere. Also, the surveyor will ask the staff about the sequence of donning and doffing PPE. We have to learn our staff about easy method for donning and doffing of the PPE. And these posters should be available and distributed everywhere, especially in the empty room of the isolation room. This is donning and doffing. For the sharp, we have to instruct our staff that there is no allowing for any recapping of the syringe or the needles. A sharp container should be hanging on the wall, not on the floor. It should be closed and should be changed only when the sharp box changed when reached to 3/4 full or which is had any odor. This is the guidelines. Some surveyor asks about the duration during which you should change the sharp box. If you mention it in the policy, okay, after 1 week, after 2 weeks. If you mention as guidelines, no duration limited. For the transfer of any instrument to CSSD, you of course ask about it. So no cleaning, no brushing available in the area. Only after uses an instrument, put it in closed box and transfer it. You allowed only to spray it by enzymatic detergent to prevent adhering of the tissue to the instrument. He may ask in staff, if you need urgent to make recapping for the needles, how can you do it? So we have to orient our staff about the scope method, in which we use only one hand to make recapping for the syringe, as it's clear in the photo. They will observe and ask about how to transfer the lab specimen to the lab. First, we have to document the patient data on the tube and wearing the gloves, then collect the blood and close the container and write all the data in the request of the lab. Then transfer it in the biohazard bag and enclosed box containing all the data of the patient and all requests required by the doctor. In case of needle stick injury, it's a common question by any surveyor during the SBAHI survey. He will ask about what's your action and to where you will inform this accident. So the action, no squeezing for the injury. The wound should be washed immediately under running water and inform the infection control and your supervisor. And go to employee health clinic. Most of surveyor ask is very, very important question. If this accident done out of duty hour of the employee health clinic, to where you will go? In this case, the staff will go to the ER, and the ER later will inform the employee health clinic. This is the management of blood spill. It's very important. This booster should be distributed everywhere and should be involved inside the blood spill kit. And you can manage it according to your policy and according to the type of the blood spill kit you used inside your hospital. Okay. The staff may be asked, of course, infection control members and the head nurses about the meaning of hospital-acquired infection. The hospital-acquired infection is the infection occurred to the patient at the third calendar day from the admission. And this infection not found or incubated on the admission time for the patient. And these are the most important for hospital-acquired infection done for the patient: central line, CLABSI, COTI, SSI, surgical site infection, and the VAP. So he will ask the staff what is the meaning of bundle and what are the types of bundle you implement for the patient. The meaning of bundle, it is the least amount of service which will be done, which when done collectively to the patient will improve the patient outcome and will prevent hospital-acquired infection. This is the meaning of bundle. What are the types of the bundle? We have 5 types of the bundle: VAP bundle, COTI, CLABSI, SSI, and MDRO bundle, multi-drug resistant organisms bundle. We will talk about them now. So for the central line, we have 2 bundles: bundle for insertion and bundle for maintenance. The bundle or the component of the insertion bundle include hand hygiene, maximal barrier precautions, which include wearing the cap, mask, sterile gloves, and sterile gown, chlorhexidine skin antisepsis for the patient, optimal catheter site selection. We have the perfect site for central line insertion is subclavian, then jugular, and finally femoral. And the daily review for central line, it will be in the maintenance bundle also. For this is the component of the insertion bundle. For the maintenance, daily maintenance for the central line will include hand hygiene, daily review and assessment for the catheter necessity, proper dressing. If we use transparent or semi-permeable dressing, if not available, we can use the gauze. Proper frequency of the dressing change. If we use transparent dressing, the change will be every 7 days. If we use gauze dressing, it will be changed every 48 hours. And of course, any type of them will be changed immediately when it will be soiled or when infection happened to the patient. For the replacement of the administrative set, according to CDC and HCC, is the duration for each set of them. If we use any component unless blood and product, the set will change it not less than 3 days and not more than 7 days. If we use blood or blood product, it will be changed the set each 4 hours, every 4 hours. If you use TBN, the set will change every 24 hours. And for the chemotherapy, it will be changed after each use. This for central line. For the urinary catheter, this is the component of the bundle. Avoid unnecessary urinary catheter. Insert using aseptic technique, which include hand hygiene, sterile equipment, small catheter as possible. And for the maintenance, we have to hand hygiene before any maintenance for the catheter, and review daily assessment for the necessity. And we have to maintain the catheter based on the recommended guidelines, which include these guidelines. Keep the catheter probably secured to prevent movement. Keep collection bag below the level of the bladder at all the time and not on the floor. For the ventilator bundle, we have 5 components of the ventilator bundle. The bed should be elevated for degree 30 or 45 to prevent aspiration. Daily sedation interruption and daily assessment for extubation. Peptic ulcer prophylactic. deep venous thrombosis prophylaxis, and daily oral care for the patient using chlorhexidine. The component of MDR bundle, which aim to prevent MDRO spread between the patient and the staff. So any patient inside the hospital infected with any type of MDRO like MRSA or VRE, this component should be implemented with him. Strict hand hygiene practice, appropriate use of PPE, daily disinfection of the patient care equipment. The patient should be admitted under contact precaution. The appropriate use of an antibiotic and adherence to decolonization practice for MRSA patients. For any patient who will undergo for surgical operations, this bundle should be implemented. First of them, hair removal should be done only by clippers, and done only if this site of incision contracted with the hair. So in this case, we have to remove the hair by clippers, and it will be done immediately before the surgery. Appropriate use of the prophylactic antibiotic according to the hospital policy and according to the stewardship program for the hospital. It will be done, the prophylactic antibiotic, within 1 hour before the incision, or 2 hours if we will use vancomycin. Prophylactic antibiotic should be discontinuing for 24 hours after the operation. Pre-operative temperature for the patient should be between 36.1 to 37.1, and the blood level glucose should be under 200 milligrams by deciliter. This is a component for surgical operations. So we talked about the bundle of the hospital. If the surveyor asks any one of our staff, what is the type of the surveillance for the hospital? So the staff should be oriented about the type of surveillance, it's active or passive. And the surveillance data should be distributed monthly for all departments and discussed monthly or quarterly in the infection control committee. If the staff asked about the most organism pathogen inside your area, it will be reflected by the infection control, and the infection control will notify each department, and it will be clear in the antibiogram. For any question related to the outbreak inside the hospital, it will refer the answer to infection control team, and the staff can answer the surveyor. Any outbreak will happen, we will notify infection control, and we will follow the infection control instruction. What is the definition of outbreak in KSA? The outbreak definition is the presence of more than 2 same organisms in the same location at the same period of time. This is the definition of outbreak. So the surveyor often asks about the isolation practice and isolation precautions. So all staff should be oriented about that. We have 3 types of the isolation: contact, droplet, and airborne. And in front of each one, we have the PPE required for each type. For example, the contact, we have to wear gown and gloves, beside the standard precautions. For in case droplet isolation, surgical mask, and for airborne, mask N95. This isolation signs should be available everywhere inside the hospital. And for any patient under isolation, whatever the type of isolation, the signs should be posted on the door to inform all the staff before entering the room that this patient under isolation. For example, if this patient under contact isolation, this sign will be posted in the door, which indicates that before enter the room, you have to wear gloves and gown. And if this patient will transfer to another department, this sign should be hanged in the trolley or wheelchair. And you should to inform, it's a very important question. And this is what the surveyor needs to hear from the staff. If you want to transfer any isolated patient, first point, you have to inform the new department, whatever radiology, CT, MRI, or ICU. So you have to inform the staff and implement these precautions. For droplet precaution like meningitis, like mumps, rubella, this poster should be posted on the door, and during transportation, we should include this card during transportation. For the airborne, like SARS, TB, smallpox, we post this sign which indicate before entering the room, you have to wear mask N95 and post this transportation card during patient transportation. You have to learn your staff what is the difference between droplet and airborne. The two mode of transmission is respiratory, but in case of droplet, the microorganism is more than 5 micron. So this microorganism can transfer during only distance 1 or 2 meters and then will settle down. But in case of airborne, this particles is less than 5 micron. So this pathogen can suspend in the air for a long time and transfer for long distance. And in this case, this surgical mask will not be enough to protect ourselves. So we have to wear mask N95. This is the difference between droplet and airborne. If the staff asked about the committee, all the staff should be aware that the hospital have infection control committee, and the committee done as the hospital policy monthly or quarterly. The infection control committee should include a representative for all medical and support service department. The leader for the infection control committee should be the hospital director or the medical director as the policy. And this is the papers, very important to be evidence for initiation of our committee. And the surveyor also asked about the term of reference of the committee, which will be the first page of infection control committee file. For any negative pressure room, he will check the negative pressure more than minus 2.5 Pascal, humidity from 20 to 60%, and temperature and the air cycle more than 12 air cycle per hour. Okay, last point of the CBAHI accreditation is the personal file. The survey may ask about them in the first of the survey. What is the person the surveyor will need their files? Infection control director, of course, infection control team, some of staff to ensure that there is infection control orientation for this staff, and he will search about the certificate or orientation program for this staff. CSSD supervisor, which should be registered in the Saudi Commission, and all staff of CSSD to ensure training courses about sterilization. This is a person which is a surveyor will check their file. What he will check inside the file: qualification certificate, job description, training courses, experience certificate, and Saudi Commission for Health Specialists. During his round, he will check some construction requirement, like in the operation room, which should be divided into 3 areas: non-restricted, semi-restricted, and restricted area. For CSSD, he will check dividing of the department to decontamination area, sterilization packing area, and storage area. For endoscope, the same. For the kitchen, also he will ask about the dividing of the area, receiving area and sorting, storage area, washing area, cooking area, and storage and washing area. The laundry, he will ask about and check the dividing of the laundry, receiving and sorting area, washing area, then drying area and storage. He will check this construction requirement for all this area. Finally, keep calm and trust yourself and your file, and you can do it, inshallah. Thank you so much. Thank you. And see you again soon in your lecture بإذن الله. السلام عليكم.